back, and Leanne Smiley is in the studio. Leanne is the home health manager. I got to meet Leanne for the first time, I think it was last month, Leanne.
It was.
And welcome back.
Thank you.
You came into the studio, you said hello or something like that, and I remembered Australia. Green Spring, Leanne is from Australia. And Leanne is going to bring us an update on home health.
I will. And firstly, you and I were just talking while we were waiting to come on about the difference between home health and home support.
Sure.
And it definitely always is a good thing to talk about because there is a significant difference. I'm the manager for Certified Home Health, and we are the agency that works with Medicare or insurance to provide care on a short-term intermittent basis after someone's had an illness or an accident. And again, our plan is to get in, bring our therapists and our nurses, our home health aide, complete the plan of care and get someone ready to go to the next level of care, which might be outpatient therapy or something else that their doctor prescribes. But we're definitely part of that continuum of care that exists here at Green Spring. So we have a lot of our residents will move from Garden Ridge, where they may have a short-term rehabilitation stay. They'll move through us, maybe go to outpatient therapy after we discharge. So we have lots of options. We also refer at the time we discharge, and I know Garden Ridge will also refer to home support. Home support is a private pay situation where the resident is responsible for the costs incurred. So Medicare will not cover certain things. It won't cover ongoing care of what it calls a custodial nature. So if you need an aide to help on an ongoing basis, that's not something that Medicare can cover. Likewise, home support also has nurses that can help with medication management on a long-term basis.
Sure.
And they do a lot of other things as well, not just medications, but those nurses are vital to their plans of care. So I think there's sometimes some confusion between home support and home health because we both have nurses. The true difference is who pays and the fact that home health has therapy as well, and we don't have as much of the aid service as home support has.
Okay, yeah. I remember the last time that we talked, I mentioned that I had come out of the hospital sometime in June, and Stella came to visit me. Is Stella part of yours?
She is. Stella is part of our team. She is our full-time nurse, and we're very fortunate to have Stella as part of the team.
Yeah.
But Stella is supported by 3 other nurses. So we have 3 nurses. Cheryl, who has been with Green Spring for a number of years. Sally, I think she's going on her 11th year here at Green Spring. Yeah. And then we've just brought on another nurse, Rosalia, and she'll be doing some of our evening and weekend work for us. So that will help to support our nursing team in Certified Home Health.
I remember when I spoke with you last month, I thought it would be interesting to see what Stella had to say about the clutter in my apartment. I have piles and piles and piles, and every once in a while I reorganize my piles, but I can't zero them out for some reason. And when I go to bed at night, I think my piles come together and they procreate. And in the morning, I have more piles than the previous day, and they're all of them larger. Leanne, you have 3 nurses on your...
So 4 nurses on the team.
4 nurses on your team.
I've also just put on a QA nurse who will work evenings and weekends for me as well.
I see. Okay.
And his job is to make sure that our documentation and everything is ready for billing with Medicare, because Medicare can be very stringent about how the paperwork is done for an episode of care, because we actually have to prove medical necessity and that the resident is homebound, which means they can't get out and have their services elsewhere in the community. So Chuck Wyson, he is joining us in that role at the moment, so he's a new addition to our team as well. But as far as the clutter that you were talking about, that's truly where our occupational therapists work, and I'm not sure whether you had an occupational therapist as part of your team. Our occupational therapists are Karen and Cynthia,
Okay.
And they're the ladies that really come in and look at the environment along with nurses.
Sure.
To make sure that the environment is safe. And the things they're looking for are throw rugs, especially on the floor if someone's using a walker or a rollator, because they have a tendency to get in and under those legs under the rugs and cause a trip hazard. They also do look at things like clutter and making sure that when in someone's apartment that you can move around safely and that the clutter itself is not impairing the ability to mobilise and do the things that you need to do.
Sure.
Because so many people will come home with a different piece of equipment, whether it be a walker, rollator or wheelchair that they may not have had previously,
Yep.
and suddenly you need a whole lot more space to move around with
Sure.
that than you might have needed when you weren't using that equipment.
Yeah, yeah. Earlier, excuse me, Leanne, earlier this year, earlier in the calendar year, it seemed to me that we were experiencing a lot of falls. And I don't know, I'm not as sensitive to that now as I was earlier. Maybe we're doing better now.
You know, we are sensitive to falls at all times of the year because different things happen. For instance, we're going into the holiday season, and as people get busier and maybe are not focused as much, there is a tendency to see more falls. We obviously don't want to see someone come in with a fall because when we see them in home health, generally they may have broken something or they've sprained something,
Yeah.
and their doctor has prescribed home health either through the medical centre or through the hospital where they went. We did see a lot of falls early in 2016,
Yes.
Possibly related to the weather. As everyone will remember, we had that large blizzard in January and the snow and ice did stick around for quite a while. Here at Green Springs, our ground staff did a fabulous job of keeping our grounds clear.
Sure, yeah.
But, you know, when people went out shopping or
Yeah.
to other places or to churches or family members' homes, there was always a possibility that maybe there was a patch of ice in a dark
That's right.
shaded corner.
Yep.
And so we did see a lot of falls during that period of
Yeah.
time.
Yeah.
Although, you know, in addition to that, we do see falls throughout the year. Again, it may be related to those trip hazards in someone's home or somewhere in the community. It may be related to a change of health. You know, a diabetic whose blood sugars are not doing what they should be doing. Someone gets a urinary tract infection and, you know, they're not quite as careful as they might be otherwise.
Sure.
So changes in someone's medical condition can cause falls as well.
Sure.
And the reason we see someone in home health is not so much to treat what the acute condition was, which might be the urinary infection or the change in blood sugar. It might be that they've had that fall and therefore we need to bring physical therapy and occupational therapy and, you know, as well as nursing in some instances. So those falls are a constant. Obviously, awareness and knowing your environment is a really important piece of that. And something to remember, as I said, as we go into the holiday season where the weather is not maybe going to be so great. You know, we may see more rain, hopefully not as much snow. But also people are busy and they're moving and they're tired. And
Yeah.
tiredness is another reason that
Sure.
people fall as well.
Yeah, sure. Now how are people referred? Is it a handoff from a doctor maybe or a social worker?
We do need a physician order, so
Okay.
your doctor needs to prescribe home care. If you go to the hospital, quite often
Yes.
the hospital doctors will do the paperwork and get it to us.
Sure.
In skilled nursing, whether you're here at Greenspring or elsewhere, the social workers have a large part in helping to get those orders from the doctor and get them across to us in a timely manner so we can start home care as soon as possible. But we also take a lot of calls from the medical centre or other doctors who are asking that we go in. They saw someone in their office who needs some additional help and they'll order home care that way. So there's multiple ways. We also work very closely with our social work team here at Greenspring and they'll often bring us residents to our attention who maybe need some home care and then they'll work with us to get those orders from the physician as well. So.
Yeah, sure. How many people are you seeing now?
Our caseload ranges, it goes up and down.
Sure.
You know, fortunately for residents at the moment, we're a little low, but generally we're seeing somewhere between 20 and 40 patients at a time.
Yeah.
That's where our census generally sits. You know, as I said, we'll have times where it's a little less and times where it's a little more. And the great thing about our team is the ability to flex up and down according to what that need is. So we have some full-time and part-time people who work with us, but we also have a great team of flex staff staff, and they're the staff that come in on an as-needed basis.
Yeah, sure. Well, I see your people, and I see also home support. The people out on the hallway pulling their
bags.
Pulling their bag, and they're on a mission. I mean, they're on a mission. I'd love to stop and chat them up a little bit, but they've got someplace to go. And so, Leanne, I'm probably going to ask questions I'm sure I asked the last time. Excuse me. How long have you been here?
We've lived in the United States for 18 years.
Yes.
And we've lived in this particular area for 3.
Yeah.
I love it, and we've had great experiences here. It's very different from other places we've lived. And I think, you live in the moment, and you really enjoy where you're at and make the most of where you're at that moment in time.
And you've been at Green Spring how long?
I've been at Green Spring just over a year now.
Yes.
I started last October, and so I've just had my 1-year anniversary, and truly enjoy being here and meeting residents and talking with residents. In my role, I do get the ability to meet people, go see them one-to-one. Occasionally, I'm able to put my nurse's hat on because I'm a registered nurse as well. So I do get the ability from time to time, maybe when we're short or we're busy, to get out and see someone in their home.
Yeah.
And I really enjoy that. I enjoy the ability to manage and work with a team, but I also enjoy the ability from time to time to really think about what my roots are, and my roots were, I've been a nurse for over 30 years at the moment, and that will always be my love.
Yeah, good. So you've been here at Green Spring, I think you said a year maybe. Have you ever seen so many old people in just one place before?
Oh yes, I've worked in senior housing for a long time. Even though I've been in home health, I've worked for other senior housing companies. By all means, Green Spring is probably the biggest community I've ever worked in. Some of the others were individual buildings where we had home health spread over different places within a city. But definitely, I enjoy working with older adults, and have for most of my careers. My first job out of nursing school was in an assisted living, so I started assisted living, and over time moved to community health and home health.
Marianne and I, we decided before we came to Green Spring, we decided we did not want to go to Florida because there were too many old people there. So we came here instead. Leanne, we've run out of time here, and I thank you so much for coming.
Thank you so much for having me.
See you next month, probably, hopefully. And let's see, Green Spring, I have some announcements here.